My name is Kayla. I'm going to be your student nurse today. I'm going to go wash my hands, get my supplies, and I'll be right back. Go wash my hands, and get my supplies. This is my sterile urinary catheter kit. Okay. So, Miss Danks, if you can please verify your name and date of birth.
January 1st, 2020.
Perfect. Thank you so much, Miss Danks. Okay, so Miss Danks, today I'm going to be performing placing an indwelling urinary catheter. I'm going to go check my orders and make sure you don't have any allergies and check the orders that the physician put in. Okay, no allergies, perfect. Okay, Miss Danks, what I'm going to do is first I'm going to first I'm going to raise the bed. I'm going to place a privacy sheet over you. Okay, and I'm going to be using proper sterile technique to open up my indwelling urinary catheter kit, okay? I'm going to utilize this as a trash can. Okay. We'll be making sure I'm using proper. Okay. I'm going to be taking out a pad. The patient already has a chuck underneath her. We're just gonna be, if you can lift your legs for me. Okay, perfect. Okay. Now I'm going to be donning my sterile gloves. Turn it off. Now that I have my barrier down, I'm going to have the patient spread her legs open, having her knees point downwards so I can better access the area. And then what I'm going to be doing is I am going to be donning sterile gloves, using sterile technique, making sure not to touch the outside of the glove. Once I've donned my sterile gloves, I'm going to be placing a barrier over the patient's penile area, exposing it. And then I'm going to be getting my swabs to start cleaning the patient area. I'm going to remove the tray. And I'm going to have my catheter out. I'm going to check the catheter. Okay, it balloons slightly, so catheter is working. Now I am going to put my non-soluble lubricant gel on the side. And then I am going to open up my swabs to clean the perineal area, making sure to open up the patient's labia and cleaning from clitoris to anus. Making sure with my non-dominant hand to hold and swiping from the clitoris to the anus, disposing, and again, clitoris to anus, disposing, and again. Next thing I'm going to do is I'm going to grab my indwelling catheter and what I'm going to do now is I am going to tell the patient to breathe in and out. And I'm going to tell her she's going to be feeling a little bit of pressure. I'm going to, with my dominant hand, insert the indwelling catheter in the patient. About 1 to 2 inches. What I'm going to be doing now is I'm going to be slowly inserting the saline. What it's doing is creating a ball. And so once I'm done inserting all of the saline solution, I'm going to tug to make sure gently the indwelling catheter is placed inside the client. After I dispose of my sterile gloves, I'm going to go wash my hands and don non-sterile gloves. Wash my hands. Then I'm going to make sure I'm going to attach the catheter onto the patient's thigh, and I'm going to make sure that the patient's bag is below the bladder. Okay? And what I'm going to do now is I'm going to dispose of my items. Patient education of a cleansing enema. The nurse will explain to the patient that a rectal tubing will be placed. Once a rectal tubing is placed, a solution will be administered. The solution is a rectal solution that is prescribed by the physician. Also, the physician prescribes the amount of solution the patient will be administered. The large volume administered is between 750 and 1,000 milliliters. Once the solution is administered, the nurse will then take out the rectal tubing and tell the patient to hold the solution for 5 to 10 minutes or as long as they possibly can. Once the patient holds the solution, they will expel the solution within a bedpan. This will activate the enema and be the most effective. Performing a cleansing enema, you're going to make sure that the clamp on the rectal tubing is closed before pouring the prescribed enema solution into the bag. Once you're done pouring the solution into the bag, you're going to open clamp and prime tubing on rectal tubing, then close clamp. You're then going to assist the patient into a Sims position on left side. You're going to place a barrier, if not already a barrier, underneath the patient and express to the patient now that you will be touching them. You're going to gently open patient's buttocks, exposing anal opening, and also making sure at this time you're inspecting and making sure that the patient has no sores in anal area. You're going to lubricate the rectal tubing 2 to 3 inches with water-soluble lubricant. You're going to tell the patient to take slow, deep breaths and again express to the patient that you will be touching them. At this time, one hand should be separating the butt cheeks, and you're going to place the rectal tubing tip 3 to 4 inches into the rectum, making sure the tip of the rectal tubing is pointing towards the umbilicus. Holding in place the rectal tubing, you're going to hold the container 12 to 18 inches above the rectum. Then you're going to release the clamp on tubing and slowly insert in solution. Patient at this time will then feel some pressure. Once prescribed amount of solution is instilled into the patient, you're going to then clamp rectal tubing and remove the rectal tubing slowly. You're going to inspect the area for any bleeding when removing the tubing. You're then going to assist the patient out of the Sims position into supine. You're then going to explain to the patient that they need to hold the rectal fluid for 5 to 10 minutes or as long as they possibly can. Once that you explain to the patient, you're going to discard of your PPE, wash hands, and lower bed, and give patient the call light and document care and assessment findings. For a retention enema, you're first going to inspect the abdomen for any distension and also assess for any bowel sounds. You're going to don correct PPE, and you're going to place the patient in Sims position on left side. You're going to place, if not already there, a waterproof pad underneath the patient, and also inspect the area, the buttocks area and anal opening for any sores. After inspecting the buttocks area, you're going to remove the cap from the solution container, and you're going to lubricate the tip with the water soluble lubricant solution. You're going to tell the patient to breathe in and out and gently insert the tip 3 to 4 inches into the anal opening. Once container is in place, you're going to squeeze the solution, keeping the container compressed when removing. Also, you're going to make sure that all the contents from the container are disposed within the patient, and then once done, you're going to then place the gown over the client. You're going to then dispose of the equipment and assist the client into a supine position. You're going to tell the patient to retain the solution as long as they possibly can, or 5 to 10 minutes. Make sure that a commode is nearby the patient. Then after, you're going to document under care under assessment findings. When educating a patient about a retention enema, you're going to explain to the patient that you will be inserting a tube into their rectum and you will be ejecting about 100 milliliters of fluid. What the patient is going to do is they're going to hold the fluid as long as they possibly can. This will help promote them to have a bowel movement. Patient education for return flow enema. You're going to explain to the patient you're going to be placing a rectal tube along with some solution or water. After this process is done, the patient should feel some relief. Administering a return flow enema, you need to don the proper PPE. You're going to then attach the rectal tubing to container and make sure that the tubing is closed. Then you're going to pour the solution into the container, opening the clamp and priming tube. Then you're going to assist patient onto their left side into Sims position and place, if not already there, a waterproof pad under the patient. You're going to then separate the patient's buttocks to expose anal area, making sure to inspect for any abnormalities. You're going to then lubricate the rectal tubing 2 to 3 inches with water-soluble lubricant. You're going to instruct the patient that you're going to slowly breathe in and out. You're going to place the rectal tubing 3 to 4 inches into the rectum, making sure to point the tip in the direction of the umbilicus. You're then going to place the container with the solution 12 to 18 inches above the rectum. You're going to then release the clamp on the tubing to slowly instill solution. Then you're going to lower container below the level of the rectum to allow the solution that's been instilled into the patient to flow back into the container. Once all the contents are flowed back into the container, you're then going to raise the container again 12 to 18 inches above the patient's rectum to allow solution to flow back in. You're going to repeat these steps, the same process, 5 to 6 times, or how many times the provider allows. You're then going to clamp tubing and gently remove the rectal tubing from the patient. You're going to then remove and discard of PPE and assist patient back into supine position. Then you're going to sanitize and don gloves to throw away all supplies.